So let's do a quick 5-minute review of retropharyngeal area. We have our divisions of retropharyngeal. So we can have the fascia layers. So number one, most superficial, outside the body, we have investing deep cervical fascia. Number two, we have the pretracheal fascia, which we have the infrahyoid or the strap muscles, the layers for the strap muscles. And then we have another pretracheal for the trachea itself. Then behind the esophagus, that same pretracheal will become buccopharyngeal fascia. It's joined together with alar fascia, and that will make us the retropharyngeal space, or danger space number 3. Importance of danger space number 3 is that it's direct connection to the lateral pharyngeal space, which is direct connection to the everything in the oral cavity. So if you have any infection in the oral cavity, it will drain into the lateral pharyngeal, drain into the retropharyngeal, then pierce the next alar fascia, go into the danger space 4, which is continuous with the mediastinum, and give us some infection in the heart. Lastly, in front of the vertebral column or the spine, we have the prevertebral fascia, and then laterally, everything will be the carotid sheath that has the internal carotid, internal jugular, and the vagus nerve. They're all innervated by vagus, which is important, except just one, stylopharyngeus, which is innervated by CN9 glossopharyngeal, and they're both found in between the superior and middle constrictor. Let's talk about the constrictor muscles. We have the superior constrictor that origins in the pterygomandibular raphe. That is just a small ligament that is behind the mandible, the angle of the ramus of the mandible. It inserts into the base of the skull, or the pharyngeal tubercle, or the basilar part of the temporal occipital bone, I believe. Then we have middle constrictor, which origins from the hyoid bone and goes to the midline pharyngeal raphe, just like inferior constrictor. It origins from the thyroid cartilage and also inserts into the pharyngeal raphe. Another interesting thing is that we have a semilunar space. It's an empty space on top of the superior constrictor, and we will call that the pharyngeo-basilar fascia, the white, basically fascia that you will see in that empty space. Then we have longitudinal muscles that are also innervated by vagus, except our favorite stylopharyngeus, CN9, and that one origins from the styloid, stylopharyngeus, going to the in between the superior and middle constrictor. The other longitudinal are palatopharyngeus, going from the palate to the pharynx, and salpingo, going from the auditory tube to the pharynx. Other things that are in that retropharyngeal space, or in the back of the pharynx, is nerves number 9, 10, 11, 12. The sympathetic trunk, or especially the cervical sympathetic, the carotid, and the jugular. So now let's talk about the nerves. So starting with 9, glossopharyngeal, we know that one does most of the innervation to the stylopharyngeus muscle. Vagus does most of the innervation to the palate, pharynx, larynx, all the muscles like the constrictors and the longitudinal muscles right here, except stylopharyngeus. It also provides us that superior laryngeal branches, which will become internal and external. External efferent to the cricothyroid. Internal afferent pierces the thyroid membrane mucosa. We also have recurrent vagus. We find that in between the trachea and esophagus. Then just lastly, accessory is the motor nerve to the tongue muscles. And then we have the cervical sympathetic trunk. So we have the sympathetic trunk that runs along the vertebral column, basically. Bigger. We have the vertebral sympathetic trunk, and then we have big bulges, the superior cervical ganglion, middle cervical ganglion. We have a vertebral ganglion, and then finally a inferior cervical ganglion. The superior cervical, middle cervical, vertebral, and inferior cervical ganglion. We know that in superior cervical ganglion, we will get branches to the internal external carotid plexus. So everything after superior cervical ganglion, straight shot, we call that internal carotid plexus, where our basically the nerves will hitchhike on. We also have the pharyngeal, and everything should have the gray communicating branches that are basically connecting, as you can see. So everything has a gray communicating branches.